Hi everyone, I'm delighted to be here today, and congratulations to Norman and the full team on the 25 years. That's wonderful. I decided to use my 5 minutes today to tell you about a project in Cape Breton that has been part of the work that I was doing when I was Director of Mental Health back then, and then eventually Mental Health and Addictions. From the time mental health staff began to leave their offices and meet with people and see them in their homes and in their communities, it became very clear that the mental health system needed to focus on much more than dealing with people's symptoms. And we knew that. We understood, and read all the books on psychosocial determinants of health. But when our staff were in those homes and seeing the challenges that people were actually living with, it began to be real. There were many challenges in Cape Breton. There still are. This is a community with major social and material deprivation, and that is likely to continue for the foreseeable future, although hopefully I'll be proven wrong on that. In the early 2000s, we did a formal housing needs assessment of our mental health clients, and we found limited access to safe, affordable, supported housing. And at that point, one of the few options that was available through DCS was what they called supervised apartments. And I think there were 3 in Cape Breton compared to hundreds in other parts of Nova Scotia. We also saw a mismatch between clients' needs and expectations around autonomy versus the availability of residential housing options that were provided through other organizations that had a range of conditions associated with being able to live in those environments. And we also acknowledged a very limited range of individualized services and supports that were available for people to be able to live safely in their communities. So in 2005, a formal proposal was created to build on some existing partnerships and programs to establish a strategy to provide a coordinated, individualized, and responsive stream of safe, affordable housing and mental health supports for adults living with mental illness in Cape Breton Regional Municipality. That strategy involved acquiring funds to build and renovate apartments for use by our clients, expanding the range of property, tenancy, living, and social supports to people living there, and including clients and those who later became tenants in planning, developing, and evaluating the supported housing program. The strategy involved bringing together New Dawn Enterprises, which is the oldest community development organization in Canada, whose mission is to engage the community to create a culture of self-reliance. It's just perfect. They took possession of the units and were responsible for project development, building, renovating, and managing the units. We had our client representatives who later became the tenant reps, and they became involved and were involved in all decisions. When we built new units, they were involved in everything from the location and number of windows to the paint on the walls. Mental health services, before we became mental health and addictions, invested additional resources into providing a broader range of supports to people. The Cape Breton Mental Health Services Charitable Foundation gave massive financial support, which was primarily to show other governments that the community was invested in what we were doing. And CMHA, the Cape Breton branch, gave all sorts of in-kind support, and particularly were instrumental in our first proposal to government. Our proposals were submitted to the federal government's Skippy initiative and later through the homelessness partnering strategy. We formed a committee to oversee the project and called it SHIMMY, Supported Housing for Individuals with Mental Illness. It is fascinating in retrospect to know there is no way, I'll talk fast, that we didn't have any written formal agreements. This was a committee of like-minded people working together to make this happen. Over the next 11 years, we included a number of additional partners: Housing Nova Scotia, CMHC. We had Cape Breton University involved in doing participant research, which was eventually published, evaluating the impacts of supported housing on people's quality of life. The Nova Scotia Mental Health Foundation, the Cape Breton Regional Hospital Foundation took over a major funding initiative that raised almost $1.4 million for mental health and addictions. $600,000 of that was earmarked for supported housing. We got also recently a major investment of $250,000 from the Sydney Credit Union Charitable Foundation that allowed us to hire an executive director and create a new organization that brings together housing, employment, education, and other supports in one organization, now called Pathways Cape Breton, and expanded our relationship with the Department of Community Services in order to provide pre-employment training, financial literacy, and the like. Now, we started with 0. We now have 39 supported apartments located throughout CBRM, all built or renovated with funding from all our partners for a total capital expenditure of $3.5 million, and the last 4 of those apartments are owned and operated solely by Pathways. The rent for those apartments, and they're gorgeous, will never go above the allocation that people receive through DCS. We also have a range of supported employment options that has resulted in payment of over $700,000 in wages to over 100 individuals living with mental illness. And these are fair wages and equal wages for the work done, not subsidized employment. And since 2015, as I mentioned, we've had a number of pre-employment training initiatives that are showing fantastic outcomes in that people who are going through that training are subsequently able to secure employment. Finally, they are now expanding to be involved in a new initiative for youth homelessness. So we've come a long way because we were able to engage governments, foundations, and Cape Bretoners, including the business community, in all parts of the community to share our vision. And our vision is an inclusive community where people with mental health and addiction challenges have the opportunity to recover and thrive. Once everyone got that part, the rest was easy.